Welcome back to the Dr. Geo Prostate Podcast, where we help men over 40 live longer, stronger, and better with age. Today's guest is Jeff Nuziard, a veteran, entrepreneur, and leader in men's sexual wellness. After a career in finance, Jeff spent 17 years developing the Regen Max Protocol, a globally patented treatment for erectile dysfunction. He founded the Sexual Wellness Centers of America and authored Reviving Intimacy, helping men reclaim their health and confidence. Let's get into it. Here's Jeff Nuziard.
Before I proceed, I just want to clarify that this podcast and all Dr. Geo content is separate from my faculty position at NYU Langone Health. The views and opinions on this podcast are my own. Our guests and sponsors are curated by me and not affiliated with NYU Langone Health. Sponsors are a way for us to provide high quality information at no cost to you so that you can take better charge of your prostate health, testosterone, and erectile function, and also how to live better with age. Welcome to the Dr. Geo Prostate Podcast. I'm your host, Dr. Geo, where it is my intention, my purpose, my life's work to help you optimize your prostate health, even if you don't have a prostate, because it's removed from prostate cancer. Hopefully we can still optimize your health and how to even live better with age as a man. And today we're going to talk about a few things with an expert, Dr. Jeff Nuziard, a specialist in erectile dysfunction and everything that has to do around that, including hormones. It's a big deal because Jeff and I were talking prior to recording with regards to, man, what's going on with the epidemic of young men? I mean, younger than 40 years old, 30 years old. The other day I saw a 25-year-old that has no libido, no sexual desire and things like that. So it's something that we're going to explore during this conversation and certainly look at his approach. So Jeff, thanks so much for being on.
Thank you. Thank you for having me. I'm excited to be here. I love talking about this stuff.
I know you do. The reason why you're here is because we spoke once and just sort of an introduction. And, I'm a sucker for good passion. Give me passion. In fact, I could be suckered up because if you could be selling me some sort of quacky oil, a snake oil, and if you have enough passion, I may actually buy it. So we spoke about things that I knew you were not quacky because I know the material as well, and you were very passionate about it. So that's why you're here, and I decided to invite you as it relates to erectile dysfunction and everything around that. So thanks again for being on.
Thank you.
All right, so let's start like this. ED is an issue. ED is an issue in terms of, many things, I think, right? So number one is if you don't have an erection for 2 to 3 months, huge red flags come up in my head. So we're talking about even from a mortality perspective, right? Mm-hmm. I think that, men who haven't had an erection for a while are at risk of a bunch of other things, either diabetic, pre-diabetic, heart disease, blah, blah, blah. Okay, that's that. Quality of life. Quality of life is, to me, very important. Most men that I talk to, if you ask them, you want to live longer, or do you want your life to be a little shorter, but with great quality of life, almost 100% say quality of life.
Quality of life.
Right? A few of them actually have said to me, I'm okay with living longer, even though my quality is not great. So it's interesting because the mentality, but quality of life. So sexual function is a big, important component of that, certainly for men. Of course, men can function sexually in many ways. It doesn't always include penetration, but when you ask most men, penetration is an important part. So let's start here. What if you had to give me a 2 or 3 minute kind of blurb on the cause of erectile dysfunction? I know there could be many causes, stress, this, that, the other.
Yeah, many causes.
What are your experience? You see a lot of these men. What do you think it's happening out there? And maybe particularly in younger men and men that are 25, 30 years old. When you and I were 30 and 25, because I'm assuming you're not 30 or 25, it's just an assumption.
That's a good assumption. It's very safe.
I know I'm not. Not only were we had libido and sexual desire and erections, but the opposite was sometimes true. Was it could have been a distraction back then that we were always,
Absolutely.
Now is exactly the opposite. So what do you think is happening out there, Jeff?
Well, again, thank you for letting me speak on this stuff. It is a passion of mine because I personally lived it. I've really been through the gauntlet. And I want to back up and talk about, before I get into my story of why I'm so passionate about this, in our 20s, people don't understand this, but in our 20s, we average 20 erections in a 24-hour period. Every male we did in our day, average 20 erections in a 24-hour period. Now, most of those were when we're sleeping, our most relaxed state, but we got them. So that's a lot of exercising, right? Expansion, contraction. That's a lot of exercising a muscle. And, we all know that if we have a muscle that we don't use, we lose. It develops atrophy. It's a bad thing. There are many causes of erectile dysfunction. In my situation, I was 40. At 39, I felt like I was a rock star. When I turned 40, I felt like I was a rock. I did nothing. I couldn't do anything.
What happened at 40 for you, Jeff? Were life changes? You get another kid? Stress was higher due to business, relationship issues? What happened?
Yeah, I went through a divorce of a 17-year marriage. Mm-hmm. And so I immediately hung it up on that. Mm-hmm. But as time went on and I was healing from the divorce and going through new phases of life and exciting things and whatever, I wasn't getting any better. I wasn't performing. And I was
you're now divorced, you're back in the dating game, and here you are, you're meeting some nice person, and then you're saying, well, you can't perform? Is that what happened? It was like
absolutely could not perform. Mm-hmm. And it was embarrassing. And I tell people often, I felt like at that point, I really need to turn in my man card. I am no longer able to call myself that. And it was a very emotional, a very mental trying time for me because I was a very sexual person. And mentally, I still had drive. I still was like, wow, I want to do this.
I want to, but cannot.
And so when I say there are many causes of erectile dysfunction, there's neurological where you got some mental blocks, you got some issues up there. There's emotional where you got relational issues. You don't like your partner, but you don't want to tell your partner, whatever. There's all kinds of issues there. There is another issue that goes under the neurological side where you could be desensitized because of a porn addiction, because of different things where you just get desensitized to the stimuli that causes you to get an erection. But the most part of erectile dysfunction is what we call the aging dysfunction. But 40 is not aging. What do you mean it's an aging problem? I'm 40, I'm young. I'm full of life and energy. My energy was dropping off, by the way. I was losing a lot of energy. My focus was getting foggy. And so that's where my research began. And I started really looking at this going, what's going on here?
What were you doing for a living at that point?
Let me make it very clear. I am not an MD, a medical doctor. I'm a PhD. Mm-hmm. Because up until this point, I was making a great living as a certified financial planner, basically a glorified stockbroker, making retirement plans, estate plans, and things like that. At this point, now it's about survival. I was really having a mental breakdown of, I'm a man, but I'm not a man. And so I got out of the business. I sold my book of business and spent all that money and dove into research. I got to fix this. And I'm not a pharmaceutical guy. I don't like surgeries. I don't want any of that. I want to fix this. Our bodies are designed to be regenerative. When we cut our hand, it doesn't glue itself back together. It generates new epithelials that mend the wound, that bridge the wound.
Yep.
Our body is designed. We tear a muscle. Those muscle fibers begin to come back together at the cellular level through regeneration. Not, let's get together and glue each other together here. It doesn't work like that. Our bodies are designed to be regenerative. So I knew there had to be a way. And I had it sounds funny, but I had a background, a pretty extensive background as a financial planner. It was a hobby. It started as a hobby and got quite educated in it, in laser physics and understanding that laser medicine, I still believe this with all my heart, mind, and soul. Matter of fact, more than ever, laser medicine is the future. There are so many things we're doing with lasers today. And I'm not talking about aesthetics, although there's tons of things with aesthetics you can do. I'm talking about medicine. There are things we're doing today that we couldn't do 10 years ago. But because of science and research, a laser, the appropriate wavelength of light, is becoming of utmost importance, I believe, in medical practices. And I knew there was a way to fix this problem. And so my laser mind was still there. It wasn't that I had discovered it yet, but I dug into hormones first because everything I was reading was lethargia, brain fog, blah, blah, blah. Look at your hormone level, look at your testosterone level. Well, I was very fortunate. When I was 27 years old, I was in a martial arts tournament, and I competed back then quite a bit.
What kind of martial arts do you do?
Taekwondo.
Okay.
But the original General Shea Hong Hee Taekwondo.
I'm actually familiar a little bit. I'm not a practitioner, but I do some other martial art. And there is a guy who's also a black belt in Krav Maga, which is what I do, who's also a black belt in Taekwondo. So I'm familiar with those that are the real deal, the real schools versus.
Yeah. Right. It doesn't exist anymore. It makes me sad. It's all Olympic style.
Yeah.
I digress, but it's different now.
Yeah.
But back then, it was a tournament of open arts. And so there were karate, there was kung fu, there was taekwondo, there was jiu-jitsu. There was all kinds of stuff.
I mean, the best men win. It's like MMA, early MMA.
Yeah. Of course, we couldn't beat each other to death like that,
Right.
And they were blood testing that day, and that's why, because they didn't want any rager. A rager at a martial arts tournament is not a good thing.
Right.
So they were testing our blood for high testosterone. That's all. They didn't test in the 80s for, high testosterone, or doctors never knew to do that. So I remember the guy said, "Wow, your testosterone level is 1185." I said, "Is that good?" He said, "That's great." I said, "Well, I'm not doing anything bad." He goes, "Oh, no, we're looking for like the 2500 level, like the crazy ones." And I said, "So that's a good number?" He said, "That's a great number." I said, "Okay, cool." Didn't know what that meant, but here's what I do know. When at 40, when I started having these problems, I went down after reading a couple different things and digging in a little bit. I go, I better go get my testosterone check. I went down and did it. 17 years later, my testosterone was 305. 305. It had dropped that much. So then I started digging in more, and I discovered that blood flow is not the cause of erectile dysfunction. It is a result of erectile dysfunction.
So it's a symptom.
Yeah, it's a symptom of. And let me explain that, because people need to understand this. It's not, I have blood flow issues. I love nitric oxide. I'm a big fan of it. I think everybody should be on it. I'm all about blood flow, and I'm all about staying moving and staying active, because that is key. Blood flow is key. Fresh blood flow brings life in your body, period. It just does. Brings healing, everything.
Yep.
So I'm not against the blood flow, but that wasn't the issue. I started finding out that inside of our penis, we have two tubes called the corpus cavernosum. And those tubes have veins that fill them up, and it's like a big sponge, and it absorbs until it's completely full. And when it's full, it like locks in the blood until orgasm. And then the muscle flexes and pushes the blood back out. And what I found was that sponge, the majority of that tissue the integrity of it is all because of collagen. And then I started digging deeper into the hormone thing. I'm like, something's not making sense here. And I dug deeper into it, and I found out we're wrong with looking at blood flow as ED first. That's something the Western medicine has been doing, and we need to stop that. Number two, we're wrong at saying that we age and then lose testosterone. No. In our 20s, everybody stops producing at some point in their 20s, 2% a year on average of their testosterone production. So when your testosterone level hits a magical number unique for your own, that's totally unique for you, I tell people, think of your body like the electric panel at home. And when your testosterone hits that level, it opens the door to that panel, and it starts turning off breakers one at a time until the last one's turned off and we expire. That is the aging process. So let me back up again to what I just started to say was losing your testosterone is what starts and activates our aging process. It's not we age and then lose testosterone. It's the other way around. So in a perfect world, what I would love to see is men, women in their 20s, at 20, get your blood drawn. Just get a basis. Just get your.
It doesn't happen. It doesn't happen.
Doc,
I am all
my kids to do that.
I am, and you're starting earlier than even me. Well, let me back up. My patient population is like 45 years old and higher on average. So it's not the younger one. Every now and then they hear about what I do, and I get the 25-year-old like I got, but mostly, right? And in that situation, of course, there's a baseline. But in terms of these, not to completely digress, for example, when should a man get a PSA test?
Yeah.
Saying, why are we waiting to
50?
Some of the guidelines say 50. family history, 45. I'm like, why not 40? Why not 35? Get a baseline.
Right.
Let's get a baseline of everything.
How about
And then,
that? How about that?
and especially a PSA and especially testosterone and all the other androgens and hormones, that male hormones, including estradiol, a baseline. I agree.
When you're in your prime, as they call it, because all the research that I found, and I found volumes and volumes, and everybody that wrote great research and great white papers, I'm not saying anything ridiculing any of it, it was all great, but they were all talking about the problem, but nobody actually connected the dots and said, here's the problem, let's fix it. But they all talk about lack of testosterone having such the androgen effect on all your major organs, your heart, your lungs, your kidneys. And when your testosterone is at its prime, that's when all your vital organs are at their prime. So let's get a baseline. And like I said, in a perfect world, we'd get that baseline and we would slow the aging process down. We're not going to stop it, but we can slow it down drastically and go back to living 90s, 100s, 110s, 120s. You know, back in the early days, in the 400 AD, people were living hundreds of years old.
Yeah, when they didn't die of infection or childhood diseases, those that lived till 20 probably lived to 100.
Exactly. Yeah. And why? They were active.
Yeah.
Nobody was sedentary. They ate stuff, whatever they grew or raised, they ate. There was no refining and processing of anything.
They fasted sometimes, which we know that there's benefit there, right?
Tons of benefit there. So many benefits to all that. So we got to look back at all that and go, why were they and why aren't we, when science is greater today than it was then? Well, sometimes we're too smart for our own good, but
sometimes we're not studying what we need to study, and we're barking at the wrong tree.
Yeah.
And I think that's changing with the kudos to the billionaires of the world. They're putting a lot of money towards longevity science. And,
I love it.
And I think that's the way to go. And so I think that there's a lot more science as it relates to longevity and quality of life, of course. So I think the tide is changing slowly, but it's definitely changing in the right direction.
Yeah, I love it. It excites me. So backing up, I was fortunate. Not everybody's that fortunate. I had a baseline at 27. And obviously I lost more than 2% a year, and it was a lot more aggressive. Come to find out, looking at my dad, never drew blood on my dad. He died young. But looking back at at what your body does when your testosterone is so low, I know his testosterone was in the toilet young. I know it was. Yeah. Just watching the weight gain all of a sudden, watching his body become frail. He aged way too soon. Way too soon.
Well, most people did back then, right? That time. I mean, all our, the baby boomers kind of changed the tide. The baby boomers are new 60s and 70s, and the 60s and 70-year-old now are the new 50s and 60s, they say, and so forth. And I think there's some truth to that. I think, well, again, I'm always careful because there's a lot of people listening to this podcast from all over the world. I live in New York, homogenous kind of certain place, and most people are active. If nothing else, they get 10,000 steps a day just because they have to walk around a lot, right? So, but even when I talk to people like you and your practice and others, and I'm looking at everyone, I'm always intrigued by older men who look great. I think that it has shifted to older doesn't mean, you could be older in chronological years, but not in biological years.
Well, all the research I did validated everything, and I was awarded a PhD for all this research. And
so the PhD came after. What's the sequence?
I did not go to.
You're a financial guy first, and then you you got your PhD in what? What's your PhD on?
Biomedical science. Biomedical.
Wow.
Yeah, and I actually got it at.
So you were one of the older guys in class.
Yeah, absolutely. I was 52 years old when I got it.
Yeah,
and so I will tell you, it was a long process to break all this down, and then you have to prove it. Just because you have a good theory. And you got to prove that theory, right? And you can't just prove it once. So I started going through the motions and started saying, okay, what do we got to do? Your sponge is bad. You're not absorbing. So we got to remodel that. But then our bodies are really good at overcompensating for injuries. So our vein systems in the penis start shrinking up and sending less volume of blood in because we weren't absorbing the amount of blood we were sending in. So then we got a vein problem now. They're shrinking up. And now the first symptom of erectile dysfunction is I can get an erection but not keep it erect. And that started with me, and 99% of people come in my office, that's their problem. And then it gets to about a 75% erection and can't keep it up, and then a 50, and then a 20, and it snowballs. And I got patients in there hadn't had erection in 5, 6. I had one patient, him and his wife, 84 and 82, and hadn't had sex in 20 years.
Oh yeah,
and not because they didn't want to. That was a big part of their life.
Yeah,
and now they're having sex 4 days a week. To
be clear, the fact that they are not keeping an erection is unrelated to premature ejaculation.
Completely related.
Right. That's so perfect. It's I get an erection, I'm penetrating, but then I go flaccid before I reach orgasm.
Why? It's called the venous leak. The sponge starting to decay. It's not absorbing enough to lock that blood in. So once I started figuring out, I'm like, okay, what do we have to do? We have to create new blood vessel systems going into the corpus. We have to remodel that collagen and get that sponge thickened up. How in the heck am I going to do that? And then we can fix the tissue if I think we can, if I'm right, and we do. It's just going to degenerate right back because we got to get those hormones optimized. So that's the basis of my study and my progress and how we were able to come up with the only patented cure in the world for erectile dysfunction in a 4-step process, and using shockwave therapy, using a laser to remodel the collagen. It's got to be a special kind of laser so you can penetrate deep into the tissue without hurting the epidermal tissue at all.
Jeff, we're going to go into that in a bit because I want to expand on that. I think that's very important in terms of to learn your approach.
Thank you for watching the Dr. Geo Prostate Podcast. Take a proactive step and improve your health and vitality with the Prolon Fasting Mimicking Diet FMD, a 5-day plant-based program developed by Dr. Walter Longo, designed to mimic the effects of fasting without the challenges. Prolon helps activate autophagy, reduce inflammation, support weight management, and promote overall longevity, all while nourishing your body. As a special thank you, you can access the Prolon kit for just $148. Use the link below to get started. Empower your journey to better health today.
I'm actually very interested. It's like, so what happened to you? So you're 40 years old. What happened to Jeff Nuziard? Let's go back to that. Let's make this a little bit more juicy, if we will. Yeah. So, okay. So here you are. You're out on dates, and you're like, oh, there's a problem.
Yeah. So
then what happened?
I started. Again, I got my blood down to 305. At that point, I was ready to hike up my skirt and call it a day. I was embarrassed. I got the testosterone level almost a little bit higher than a female, but not much. And this is bad. And so I started like everybody else did. Well, let's try this stuff that I rub on my arms. Let's try this gel I put under my armpit. And I tried all the topicals. And I the best I could do was 700. 700 is not bad. That's average. That's okay.
Did it not do it for you? Did 700 do it for you or no?
It helped me a little, but the sponge was already damaged. Mm-hmm. The collagen was already damaged and degenerating. Mm-hmm. So the fact that my hormones, it helped my mind fog for sure. It helped. I wasn't lethargic anymore. I had energy. I was moving again. I was doing really well physically. All my vitals changed. All my blood work changed. But what was bugging me was I had 4 different papers from 4 uncorroborated resources that all stated if your hormone levels are that of your prime, all your vital organs will work as they did in your prime. And I got a lot of diabetes in my family. I got a lot of blood pressure issues, and I got to have all my vital organs working at their prime if I'm going to beat them and do better than they did. So it wasn't working. So then I went to the injectable route, and everything I could find in any journal or any kind of white paper was not positive information about the injectable testosterone at all. And so much so that congestive heart failure, stroke, hemoglobin, hematocrits going through the roof, all kinds of problems, all related to injectable. And I started looking at it's cottonseed oil or grapeseed oil, and the testosterone is infused in that. So your body has to break that down to absorb the molecule, the testosterone molecule. It's very hard to regulate. My biggest issue that no physician or scientist has yet to answer it, nobody has answered this question, why is it that no matter how big, short, tall, fat, skinny, whatever you are, it's the same dosage? Everybody gets 1 ml once a week. Makes no sense. A guy 5'8", 140 pounds is the same dosage as a 6'4", 300-pound guy.
Yeah.
Makes no sense to me.
Are you referring to a specific TRT approach? So is it
it's
cypionate, does it propionate?
Yeah, any of those. It's all grapeseed or cottonseed.
I think right. So yeah, I think they're so.
Well, so here's the half-life of that stuff is 3 days.
It's 3 days, right? So what they're doing now, and I'm saying this because I work with them. I prescribe, me personally, natural approaches to optimizing testosterone. And of course, that can work. It may not work. It depends. There's a lot of things I'm asking them to do. And sometimes they can't do it. So we need to get them kind of to do something else, right? And the prescription, I think, is 2 times a day.
Yeah. You're going to inject, that's the best way.
Yeah. That's what they're doing now. Just to be clear for the audience who's probably taking, 2 times a day, and say, wait a minute, is it supposed to be once a day? Once a week? Yeah. I'm sorry, not 2 times a day, twice a week.
A week, correct.
And typically like a Sunday or a Thursday kind of thing.
Yeah,
and as opposed to once a week.
Fridays. When I did that, I was like, this doesn't make sense, because I felt really great for 3 days, and I go,
then drop.
I'm not feeling so good. And by the next week, I couldn't wait to get that needle. I felt like a fiend. I'm like,
right. But you saw that you felt much different. And at the time, again, so back in the 40s, I want to get more into the juicy stuff. What happened to Jeff Nuziard when was the point where like you hit a home run?
When I started doing the injectable, I started performing better. Wasn't my prime yet. And I'm like, well, maybe it really is an aging problem. And I'm like, wait, but no, got to go back to this sponge issue, this collagen issue. I know there's something to fix there.
And you were already studying it. You were kind of, you were your own guinea pig at that time.
Absolutely. And it absolutely was. So I ended up spending a bunch of money, and I actually paid a few guys to be guinea pigs with me. And I paid them a lot of money, and they let me biopsy them and start doing biopsy of the corpus sponge, and let's check the collagen levels. And we did histologies on them, and so in doing all this, I realized laser is the only way to get this collagen. You got heat or injury, and nobody wants to injure their penis, so heat is the only way I'm going to get that collagen to thicken back up and restore the life and the absorbency of that sponge.
How does that work? How does heat can affect the collagen and the spongiosum?
Well, we've been doing this forever. Laser medicine has been doing this forever, since Dr. Gold in 1980 actually did the first facial peel with a ruby laser in 1980.
For aesthetic purposes? For
aesthetic purposes, but collagen in the face, there's no difference. It's the same kind of collagen that's in the penis. So if a laser could restore collagen in a face, it can restore collagen in a penis as well. If you can, and this was the kicker, if you can get the energy, the light energy, into the corpus cavernosum without burning everything that's between the laser and the corpus cavernosum. That's the whole key. And I had started running out of money. I got a job as vice president of a laser company. And they had developed the only patented laser that had an extended pulse duration on it. And that's when the light bulbs went off for me. And I think I got this figured out. And I started researching on myself and others and using this ultra long pulse duration. I'm talking the seconds regime, not microseconds or milliseconds, the full seconds pulse duration regime, which allows the absorption rate into the tissue to happen at the target without burning everything in between. It's almost like it's not, don't take this as an exact answer. It's almost like heating from the inside out. It's not. Obviously, it's going transdermal, transepidermal, transdermal, transcorpus, but that sponge is what got hot, not the in-between stuff, all due to pulse duration. So we're able to come up with the right settings, right frequency. I started seeing major improvements. Again, I was functionable for about 6-7 years. I was okay. I just didn't have, that amazing prime experience.
Were you your first patient to study?
I was.
So
It was, yeah,
things could have gone wrong.
really wrong. It was already broke anyway, right? So, I mean, it was like, what am I going to do?
Well, apparently it wasn't completely broke, because with the testosterone you did better.
I did better.
And you just wanted to do better from there, and you could have gone the other way. I would think you would, but you were very confident with the approach, apparently.
I was, because I believe in science, and there were so many supporting papers out there about the breakdown of collagen in the corpus tissue that I'm like, I do know how to fix that. And if that is the problem, I know how to make that happen. And so started working on it, then got a couple guys in there, started working on them. They started seeing response pretty quick, by the way, pretty quick. Then I developed an injectable fluid that's a stem cell replacement that allows us to recover at a cellular level like you're in your 20s. So this recovers very quick and starts regenerating at the cellular level, the corpus tissue, the vein tissue, the smooth muscle cells of the penis. All that started developing and becoming stronger. And I tell people all the time in my office, we're going to take your penis and put it in the gym for a while, and we're going to take it back to your 20s. And that's exactly what we figured out.
So fixing the collagen situation in the local tissue, it's two ways from your experience and your clinical work. One is the laser, and the other is with this stem cell injection
and shockwave therapy as well.
So it's a trifecta. That's the trifecta.
And getting your hormones optimized so you can stay there.
Okay.
Yeah.
Tell us a little bit. So the one that has had a significant amount of research as of late is shockwave therapy. I haven't seen much with laser, maybe because then people are not just focused on that. And certainly in stem cells, I see stem cells for many other things, but you wonder if it works for my knees and my joints, it could work for, but I haven't seen a lot of research, certainly a lot of research around shockwave therapy. Why don't you expand on shockwave and what we know with regards to shockwave therapy?
So what shockwave is going to do, and the reason why we use it is because you have to fix this problem, and that's the veins that we got to. All the veins that are there when we start are full of atrophy because they've shrunk up and send less volume in because you weren't absorbing the right amount of blood anyway. Mm-hmm. So we need to create new blood vessel systems in the penis. Shockwave does that. It's been proven time and time again. The problem with it is that by itself has a 60 to 62% success rate. That by itself. Not bad. Not bad success rate. But what if we can get better? And that's when I started plugging in the laser, started figuring out, wait a minute. Now I have a clinical study that we were issued the patent around, which took 5 years to get that patent issued. But I got a clinical study of 250 patients. We have a 97.2% success rate. To date, with clinics that have bought a license to use our protocol and our clinic, we're over 3,000 patients strong that are into this program, and we have maintained 97% success rate. So it's not my clinic, it's everybody that's doing this. We have one clinic, by the way, in Oak Brook, Illinois, True Male Medical. They actually were the first ones to buy a license to use it. And I don't even want to say this publicly because it's not going to last. But after their first year, which was October of 24, ended their first year of having this license, they had 61 men go through the program in their first year and not one fail. Not one fail.
So and how do you measure? I mean, is it, a shim score? How do you measure success?
We shim score, but basically to break it down for everybody to understand, we said 80% erection, penetrable to orgasm. And that's what we're getting. And
so how about the guy that wants to last a little longer? Does that?
Yeah, it is. It depends the severity of it. And it also depends on how you take care of yourself.
Right.
If
you still have to take care of yourself and exercise and eat right and all these things.
And if you don't, then you're fueling toxins into your body that are there to destroy things like collagen. Yeah. I'll tell you one thing, Doc, people don't understand. Through my research and all this, I found out people think the sun and smoking are the biggest destroyers of collagen. The number one destroyer of collagen, sugar.
Yeah.
Number one.
Somehow I'm not surprised about
Think
that.
about everything in our diets today. Go to the grocery store and read labels.
Yeah. It's sugar in one form or another, whether it's high fructose corn syrup or dextrose or something.
Or processed white sugar, whatever.
Yeah.
We have it's so much sugar that we are ingesting as Americans, which is why we have an obesity problem. We have a diabetic problem. We have erection problems. I mean, it's a problem. And so we can fix the tissue, we can fix the collagen, we can fix it all. But if you continue to destroy your body by putting toxins in, it ain't going to last.
And just to be clear, Jeff, you know this, people can make their own stories up to support their behavior.
Of course.
I want to make sure you don't misunderstand Jeff's advice here. It doesn't mean that you should smoke or continue smoking. If you're a smoker, please do not do that. Don't create your own stories. Smoking is probably the number one thing that most people, if nothing else, should stop doing.
People understand when you smoke a cigarette, it slams your vasal systems shut. I mean, blood slows down by 50% by smoking a cigarette. 50% of your blood flow. Think about that.
Yeah, exactly. All right. So we have the trifecta there, which is laser, shockwave therapy, and the stem injection. That sounds amazing. And then we have the hormones. That's the other layer to it. Now, it doesn't sound like it's a one and done. So you come in today, you get all these things, and you're done and you're good. How long does it take to regenerate and to have enough healthy tissue to be able to have healthy erections for as long as possible?
Great question. And it's different for everybody, depending on severity, depending on your willingness to work the program. Our program, the protocol calls for 1 year of treatments. And it doesn't mean it takes a year for you to work. It's not the case. Listen, I've had crazy results that I don't ever quote because I don't want people to say, well, that you said it would happen in this fast.
If it's too good to be true, it may be too good to be true. I think that's the way people's attitudes are.
Yeah. So I look at the average, and the average is usually by the 4th, 5th treatment, you start to see changes. By the 8th, 10th treatment, you're doing really well. And for sure, by the 12th treatment, on average, you're back and doing great. The reason why it's a year's worth of treatments, just like going to the gym, when you see your body begin to change, that's not time to quit. That's time to dig in and keep going. And so you're back in the game, but how about we solidify everything we've done here and make it strong so it lasts and you don't see me again. We're done. And that's why we do it for a year long. And I will tell you, we've had some really tough cases, guys that have had complete prostatectomies that have taken 7 months to get back in the game again, 8 months. And so a year, people think it's a long time. It's not. And it's a regenerative process, right? You got to keep that in mind. We're regenerating tissue. This isn't something magical, snake oil that we rub on it and we snap our fingers and we're good. We're regenerating tissue. We're making it happen. One of my favorite stories ever, orthopedic surgeon in Bentonville, Arkansas, very well known. I could go on and I'm not going to expose who he is, but very well known, works a lot with pro teams, athletics.
Yeah, you could name his name. I mean, this guy's Anderson or something. What?
And I can, because he told me, go ahead and tell people. Chris Doherty is his name. And he's Kansas City Royals orthopedic surgeon. I mean, he's amazing. He's just an amazing orthopedic surgeon and done a lot of amazing things. Got prostate cancer, and a little over a year ago, had a prostatectomy. Mm-hmm. November was his 1 year. And all of a sudden he's like, I want your program. I got to do it for me. After his second treatment, I get a text message, and that night, oh my God, you ain't gonna believe this. Had sex with my wife for the first time in over a year. A week later, I love you. This is the greatest thing I've ever done. I actually came home for afternoon delight. It was amazing. You know, those kind of stories, those are the ones I'm afraid to tell, because I don't want people to say, well, that could be me. And 2 treatments, I could be back. Maybe.
Right. It's the whole thing. And for it to stick, right? It has to stick.
And everybody's different. Everybody heals and regenerates at a different pace. And what's the severity of the damage that's in there? That's the thing. He had a prostatectomy. He had zero response to stimuli of any kind. And it didn't take much to regenerate that stimuli. With him, now, by the way, he's religiously sticking with it, and he bought a license, and now he's doing it at his clinics.
Sure.
In Arkansas, and doing very well with it. So,
any oral pills? So any of the PD5 inhibitors, the Cialis, Viagra in the program, how do you go about that?
So again, I'm anti-pharmaceutical. And by the way, let me talk about the PD5s, because people think they get resistant to them or something because they say, well, it's worked for the last 2 years and now it just don't work anymore. Newsflash. It's because the sponge has decayed more to where now your veins are still dilating. You take those pills, you're still getting vasodilation and you're still getting blood flow. It's just you got nothing to absorb it. The sponge is bad. That's the problem. Fix the sponge. I got urologists that argue with me all day long because they never heard of this and they don't understand this. And his urologist, by the way, Dr. Doherty's urologist, is blown away, and he's starting to send all his patients over to Chris because he's like, this is unbelievable. I would have called this snake oil.
Right.
Yeah. Most urologists call me snake oil.
So do you use, it sounds like you fix a spongiosum, but it sounds like there is probably some benefit to something like PD5 inhibitors, perhaps.
To answer the question, at the beginning of treatment, we tell people, listen, we want you to use this. We want you to be active sexually. You're not responsive at all in any way, shape, or form. So let's use Trimix. Let's use Cialis, Viagra, whatever works, just so you're not getting more atrophic and you're getting expansion and contraction. You're using it. We like to see them at the beginning do that. We don't push it on anybody. If they don't want to, if they ask about it, we're saying, absolutely, we'll help you out. But we limit it. And we won't.
I think you can, there's a good, you could probably use a good natural supplement with some science behind it I guess this is a shameless plug for Mr. Happy XY Vigor, which is, I'm the formulator. But all kidding aside, it's hard not to be biased when it's your thing. So
yeah, of course,
it's always a bias. But it all started with something similar, not with me, my own, but with my patients. And I'm like, I love herbals and botanical medicine. That's part of my elk. And I studied it extensively. I belong to several professional organizations. But then you see clinically, well, this work. Let's try this. Horny goat weed. Yeah. Oh, not really working. Wow. Here and there, and then you see, wow, this, worked and so forth, and that worked, and that didn't. You just, that's why it's called a practice. And you try it, and then you come up with something that's unique. So there are some herbals out there that are just phenomenal, and certainly it's interesting because I think that it would work very nicely with the whole program. By itself, oftentimes I say, look, take this herbal, but take 5 milligrams of tadalafil a day, so Cialis. I think both is better than one, right? Mm-hmm. Herbals take a little bit longer to work, but they work. It's not a quick fix. So I wonder if that could be something that could be, keep them hard.
It would. It absolutely would. And we want people to use that because, number one, it helps them mentally. It gives them a little bit more competence back. It gives them that confidence.
Empowerment.
Yes, that confidence.
I'm in control. I'm still in control to some degree.
We got to get out of their head.
Yeah.
Because once a man experiences ED for the first time, every time he's about to go in for the moment, boom, that big news flash goes through his brain. What if I don't work again? What if? So we want them to use it. We want them to be active. But again, I don't want that to be your crutch of I can't have sex if I don't take this pill. We want you to know you're back, man. You're back, and you're waking up with erections, and you're doing good. If you're not able to have sex with your spouse, you might need a therapist with your spouse.
Jeff, I wonder. I would not, under any circumstances, want to have erections like my 20s or have the libido I had in my 20s. I don't want that. It was, again, a distraction. And honestly, it wasn't good. I'm very happy where I am now at 52. Is it possible that you could get some guys in trouble actually, but they get so well that, have you seen that? Have they reported that? Hey,
Yeah.
this is working too well. How can we, how can we reverse it? What I have now, how can we degenerate from all this regeneration?
The difference is this: where the libido comes from, it is the hormonal side.
Yeah.
So
that could be tweaked.
Exactly. Just because we've fixed the tissue, that's great. But I will tell you, most men don't want to tame it down. What they want is their wife to catch up. And so the patent also covers women as well.
Okay.
And we're able to treat women as well, because women, the problem with women, they suffer in silence. They don't want to talk about it. And you know how many women out there, and I know this for a fact, this isn't something I've made up. How many women out there are hoping their husbands get ED?
Yeah, I know. Yeah.
Because it's painful.
Yeah.
They
don't want them to cheat. They don't want to. They don't want them to cheat on them as well. So they yeah.
Yeah. So we work on women, and we don't advertise for women at all. But what happens is what you just said. The men are going, man, listen, I'm doing great. You've done a great job here, but my wife, man, it hurts, and she's not into the game. Like, what do? Get her in here. Let's talk to her.
We need to help your wife too. Yeah, no question.
Mm-hmm.
Well, Jeff, thank you so much for being on. I think this was great in terms of a whole different approach and a whole different focus as it relates to erectile dysfunction. Is trying to, treat the cause. And treating the cause is the name of the game, certainly in my mind and my practice and my philosophy. So final words, Jeff, on anything with regards to your approach to ED, and where can people find your work or information about you?
Well, I appreciate this again. Thank you again for having me on it. As you said, I'm very passionate about this, having lived through it, and I understand the problem with it. But the name of the clinic is Sexual Wellness Centers of Texas, and it's swcofusa.com. But that's where the clinic is. But if you want to know more about the only patented cure for erectile dysfunction, there isn't another one out there. Believe me, there's not. Look it up. Don't take my word for it. Look it up. The only patented cure is Regen Max. And if you go to regenmax.com, regenmax.com, if you're a practitioner, a physician, and you want to discuss putting this into your practice, we'd love to talk to you about it. We've got a great team that'll help you out. The bottom line is we can only fix so many people. But if we get physicians out there that see this day in and day out, we can change a lot of people's lives together. So that's really my heart in it. I don't want any man to feel the way I did at 40. I had to go get therapy for it. I mean, I'm not.
Yeah, sure. Absolutely.
I like, there were times where I was like, maybe not being here is better than being here. I don't know.
I know. It does that to a lot of men. That's depression and all sorts of things.
Tons.
Jeff, thanks so much for being on. I really appreciate your knowledge, expertise, and your work around this area. Everyone, thanks for tuning in. This was amazing. I actually learned a couple of things I didn't know about laser therapy, for example, as it relates to erectile dysfunction. So this is highly educational. I'm glad you're here. I'm glad that you are getting this information so that you're empowered as a self-health advocate. So keep tuning in. Don't forget to go to drgeo.com, where I send emails a couple of times a week to our audience, giving them things that sometimes I cannot do on this podcast. If I know it, I want to give it to you so that you can take action and be proactive and really be in charge of your health. So thanks. This is Dr. Geo signing off. Much love. I'll talk to you next time. Thanks for tuning in to this week's episode of the Dr. Geo Podcast. You can watch all episodes of this podcast and much more by subscribing to my YouTube channel. If you love what you heard today, you can help by leaving a 5-star review of the podcast on Apple and Spotify, as each review helps us reach more men who are serious about improving their urological health and how to function better with age. And for the latest research and actionable takeaways in the world of men's health and integrative urology, sign up for my newsletter at drgeo.com. I'll see you next time.